It's a great day and that beautiful day outside, nice and sunny and cool. From hanging lights to hauling in a 12-foot tree and bending over to hug the grandkids and, of course, that thing called Arthur. A lot happens to the back that will leave you feeling like a Grinch. So if over-the-counter meds or physical therapy isn't working, you might need something different to get rid of the pain and get you up and moving again. Here with more, please welcome Dr. Sam Bailey with North American Spine. Hello.
Thank you, Deborah.
There are so many things that can go wrong with the back, and we were talking to the commercial break. He said it's an epidemic.
It really is. More than 85 million Americans suffer from chronic pain, and it is a major health issue in the United States.
Yeah, because it can be debilitating, and it costs us a lot of money in that. A couple of reasons for it. One can be disease. The other is injury.
That's correct. Disease or injury of the spine can then incur chronic pain for people that can be debilitating and alter their lifestyle dramatically. And only people who are suffering from disease or injury of the spine, the cervical spine, the neck, the mid-back, the thoracic, or the lumbar spine can really appreciate the pain it can create.
Yeah. The first thing to do is to figure out the cause of the pain.
Diagnosis is the key. A lot of people have strained muscles this time of the year, getting the Christmas tree out of the attic,
you
that
get
sort
a lot of stories,
thing.
don't you?
You bet. But it's those people that suffer continual pain day after day that usually are taking prescription medications, having trouble sleeping, their lifestyle has been altered. Those people usually need some sort of surgical intervention.
Okay, tell us what to expect at North American Spine.
Well, North American Spine has over 30 procedures that we offer to patients. You should always match a procedure to a patient and not a patient to a procedure. And one of our procedures that's very interesting is called the Accuroscope procedure, whereby we are able, through a tiny 3mm incision, Deborah, to access the entire length of the lumbar spine with this steerable catheter. There's a laser and a camera in this device.
Because it used to be you were having to cut it all open, right?
Exactly, and that approach is vertical, perpendicular to the spine. We're able to go horizontal with the spine, so we're able to treat multiple levels of the spine with one tiny 3mm incision.
Oh, wow. Okay. And what that says to me, too, is that the downtime for somebody is drastically cut.
Well, this is an outpatient procedure. Folks are back to normal activities within 2 weeks, usually, if they're a candidate for this procedure.
Right.
Yes.
And what does the procedure exactly do to address the issue?
Well, I believe that folks are seeing a video right now on the screen that's showing how that, first of all, the device is placed into the 5th sacral vertebrae, which is a natural opening. We only have to remove a small amount of bone to access the spinal canal. And then as the screen shows right now, the catheter is put into place, and along with the catheter there is an endoscope which allows the physician to see in high definition color on a monitor the anatomy of the spine that is creating the pain that radiates down from the buttocks into the legs and the lumbar spine. And then the catheter is guided up carefully through the spinal canal, and when we encounter tissues such as scar tissue, herniated disc material, bulging discs, herniated discs, we're able to treat that with the laser and able to dissolve those impingements of the spine.
And that's what's amazing is when we say laser, and I think a lot of us still, we don't really know what lasers do.
Oh, the laser's amazing.
Yeah.
It treats the annulus of the disc that is pressing against the nerves that has ruptured, and we're able to vaporize those fragments of the disc that are pressing against those nerves and remove them completely, and thereby resolve the patient's pain.
Yeah, and helping in healing because it doesn't cause that scar tissue that oftentimes cutting can cause.
Exactly, exactly. It's a cauterizing effect on the disc, so it has an amazing healing capability.
Now, who qualifies for this procedure?
Well, diagnosis is the key. Patients should send their MRI. We're now open here in Houston, and we have a tremendous number of doctors here in Houston, and they should send their MRI, and we will give them a free MRI evaluation, let them know if they're a candidate for this procedure or one of the other
if not this one, so many other ones that they can be. And oftentimes, patients have potential immediate relief.
That's exactly right. When you remove the impingement of the nerve, then the pressure's taken off the nerve, immediate relief. And so, yes.
Something to be said for pain medication. We certainly know everything from an aspirin to something stronger that can get rid of pain, but the key is to find out the cause. And if you take care of the cause, you can take care of the problem, because we know that other things can happen when people depend on medication.
Treating symptoms is not always the best thing to do. We need to get down to the root cause and treat that if we can, yes.
And let me just say that you are not only the chairman of North American Spine, but you're also a client.
I had the procedure. I had the procedure on May the 4th, so I'm speaking with some personal experience. Yes, ma'am.
Yeah, but that's got to be good to be able to do with the patient and say, I know what you're talking about.
I know the pain.
Yeah.
I know laying awake at night. I know flipping through channels and watching KHOU late at night. I know about all of that.
But you're not complaining about that part, though.
No, ma'am.
No.
But not being able to sleep.
Was watching Great Day.
No doubt about it. But I know about all the debilitating things that people deal with, and so the procedure caused me to be pain-free the next week.
All right. Again, North American Spine has a special offer. Upload or send your MRI or CT scans, and they will review it for free to see if you qualify for this procedure we talked about or any of their other procedures. You can call them at 713-396-5194, 713-396-5194, or log on to spinecarehouston.com, spinecarehouston.com, and go through the holidays pain-free. We'll be right back.
This is our